Hi, I'm Dr. Carmen Jimenez, and I want to share with you quick ways to tell if you have allergies, a cold, or a viral infection like COVID-19. Before I start, I'd like to remind you that you know your body best. Even when I'm listing symptoms, this may not apply to you. And so the best way to determine whether or not you have something is definitely to reach out to your primary care physician. Okay, so if you have allergies typically present with itchiness. You'll have itchy nose, itchy eyes, watery eyes. You'll have nose congestion, more like a runny nose on the outside. Some people have postnasal drip that goes on the inside, and that'll tickle the throat and cause a slight cough. So that's a typical allergy symptom. And if you take an antihistamine, that'll go away. The common cold is slightly different. You have your head colds and you have your chest colds. Your head colds, that means most of your symptoms are in your head, in the head area. And so you'll experience things like headache and facial pain or sinus pressure. You'll have the nasal congestion. It'll feel like things are stuck there. You can't really breathe. If you have postnasal drip, you'll have the same as the allergy. You'll have that bit of an itchy throat and a slight cough. However, if you have a chest cold, that means everything is really focused in your chest area, you'll have serious chest congestion, meaning you'll want to cough a lot because your lungs want to get rid of the mucus that's been building around. So your cough will be very productive and very frequent. You may also have a headache or facial pain, and this is probably from the coughing. So that's allergies and that's a cold. COVID-19 is a virus, so the symptoms for the COVID-19 are slightly different. Based on what we know so far, we know that early onset symptoms are loss of appetite and loss of sense of smell. These kind of go hand in hand because if you can't smell your food, you really can't taste them, and you probably won't have a desire for them. Now, this loss of smell is slightly different from when you have an allergy or a head cold, in that the congestion is not going to be as pronounced. So that's one thing to look for, that there isn't going to be a lot of congestion in your nose. The second symptom that will probably show up is the cough and the difficulty breathing. Now, this cough is different from the tickling throat cough because of the postnasal drip. This cough is going to be because you cannot take a deep breath in or a regular breath in. You can't really reach over your head or hold your breath because doing that either seems impossible or you start coughing. The cough is not going to be productive. It's gonna be a cough like almost like you can't cough. The third symptom is the fever. Now, this is a huge tell sign because allergies do not provoke fevers in the body, and neither do common colds, because the common cold is more bacterial infection. If it gets to that point, typically the body is able to handle that type of infection without having to raise the body temperature. Raising the body temperature to cause a fever requires a lot of energy, and this is why a lot of people with COVID-19 become fatigued, because their body's doing just so much to fight off this virus. If you have any of these symptoms and are unsure of whether they're allergies or cold or virus infection, definitely reach out to your primary care physician. You do not want to go to the emergency room. Chances are that you're not infected if you've been staying at home in quarantine, and you're going to increase your risk of exposure to the virus by merely going into the emergency room. Not to mention that you're going to have a bigger bill from the emergency room than you are from your primary care physician. We can do a virtual visit and assess the patient via the video, and then if we determine that they are possibly infected, then we can order the nasopharyngeal swab test to be shipped to your home. You do that at home so you don't have to leave. You ship it back. And within 3 to 4 business days, you'll have the results. Once we have the results, we'll be able to guide you as the proper follow-up steps to take based on your presentation. And all this for the fraction of a cost of going to the emergency room and without leaving your home. So take advantage of these telemedicine visits. If you have any questions, definitely reach out to me. I'm here to help. Do not fret. Stay calm, stay informed, and stay safe.